Parents, Dr. Kirsten Fulong here from Pinnacle Chiropractic in the Sarasota and Bradenton area. Today I want to talk about the root cause and sometimes maybe the most overlooked cause of kids' health challenges now today, and that can be a difficult birth process. More specifically, I would like to cover C-section complications today because we all know that that is becoming increasingly more common, more and more often, with more moms needing or requiring emergency C-sections, lots of birth interventions that create a very stressful birth for mom and baby. So in our office, the kiddos that we see that have the most stress and challenges in their bodies, we always take it back to the severity of the birth because we think in our heads, what is the root cause of this issue? We actually have a family in our office where mom was pregnant with twins, and she was aiming to have a natural vaginal delivery with her twins so that they could have the best start to life. She was really on it with her health. She wanted to make sure that there was as little interventions as possible with her birth. So during her birth, Jace, the first twin, came out head down and with ease. And when she started to push for her second, they realized quickly that Ella was actually not head down. And so because they're not trained to do breech deliveries vaginally, they had to do an emergency C-section in this case. So they told mom, stop pushing. She had to stop pushing, which is incredibly hard when you're a mom in labor. And they rushed her to a very stressful emergency C-section that was pretty traumatic for her, honestly, especially with her idea in her head of how her birth would go versus actually how it went. Now, there are a lot of reasons that this was traumatic for both mom and Ella. Ella needed significantly more care in the NICU than Jace did. They're both genetically very similar, but they both had totally different birth experiences. Jace's adaptability to stress, his immune system function, and health overall was stronger than Ella's, as we saw long term. Ella had a more longer hospital stay, and after they were finally discharged, over time, mom notices all these differences with Ella versus Jace, especially with their stress responses. So, mom, knowing what she knows about our care and chiropractic care in general, she sought out our care for both the twins, but especially Ella, to help her recover from the stress of that birth process. And after seeing her more consistently, focusing on areas in her body that needed that stress release, mom saw a lot of positive changes with Ella and even noticed that the weeks that she didn't get adjusted were a total nightmare for her. She was actually able to sleep better, nurse better, have more regular bowel movements, and stay healthy with her immune system, as opposed to Jace that didn't need as much intensive care in the beginning as Ella did. So it's in twin births like this where we're really able to isolate that yes, there's a difference when kids have a C-section birth versus a natural vaginal delivery, especially when they have the same genetics and a different birth. That's really where we're able to see that difference. There's a huge difference that we see in vitality and health between twins when simply the birth process is different for each. Now, when we look at C-sections, there is a lot of evidence that shows that C-sections versus a vaginal delivery, kids just have more complications in general, and we see that correlation strongly in our office. Generally, their APGAR scores are lower with C-sections. Their digestive stress is seen in a lot of those kiddos as well, which creates issues with the gut function, which creates a slew of issues later on for these kids in their health as well. So not only is digestion affected, but we also see differences in respiration, immune system function, motor function, and tone, which is a big thing as well. All of that go back to the birth and delivery process. The first stress that we see and we analyze as pediatric chiropractors is a ton of stress and tension put in the upper neck region. And where is that first stress put on that neck? In the birth process. So that's where we look as chiropractors, what happened in that birth? What happened exactly? Were they vacuum extracted? Were they C-section extracted? Did they come out without any interventions? All of these things really matter on what we're seeing pattern-wise in their bodies. So to get baby out of the incision in a C-section, this puts even more stress on that head and neck than a vaginal delivery. The amount of assistance needed to get baby out puts more stress on that tiny spine. And this makes a huge impact neurologically because guess what lies right up here? Your brain connects to your brainstem, which connects to the rest of the nervous system. So this is a very delicate and fragile area, especially for babies. And so when they need more twisting and pulling to get out of a smaller incision area, this creates more impact neurologically. A huge component with the gut is the vagus nerve. And that vagus nerve actually runs right through this upper neck area first before going all the way down into that gut area. Another huge factor with C-sections is respiration, breathing. Because when babies don't go through that birth canal, that's not giving them the pressure that naturally happens when they get through that birth canal. And this doesn't activate the lungs as well as when they're being pulled out via C-section. So there's not that natural contraction of the mom's birth canal and the uterus to get them through. So that actually contributes to more respiration and breathing challenges later on for these kiddos that are born via C-section. So I'm going to show you a neurological scan done on an 8-year-old in our office. So this kiddo, I'm going to pull this up right here. This kiddo was born via C-section. So when we're looking at this, I like to focus on the top graph up here. So what we're seeing here with his scan is that his top neck area, which is C1, which is the same area that I talked about with the vagus nerve and the stress and the tension put on that upper neck area, that is actually showing us a pattern. He's now 8 years old, but he has been holding this pattern for a long time because we're seeing areas of red all the way up here in that neck area right here, and then right below it we're seeing areas of blue, which is more moderate tension, but red is more significant tension, and that also indicates chronicity. So if it's been there for a long time, that body has actually stored that as a stress pattern. So that can affect things like emotions, behavioral outbursts, tantrums, and then when they get to this age, parents more notice this as ADHD, focus challenges, and issues in school. So it might start out as latching issues, inability to sleep well, kind of like colicky behaviors when you're a baby, which morphs into greater challenges later on if this is not addressed. So as you can see in that scan, that's what we're measuring to see where that stress and tension is affecting them in their body. And so typically with C-section births, that is what we see. So after we look at that scan with this kiddo, the reason this happens is that this upper neck area is kind of like air traffic control. It modulates and controls every other system in the body, from the gut, the immune system, mood and behavior, sleep, hormones, digestion, and so much more. So when we have a difficult birth that creates that first stress on the upper neck area, especially with that extra pressure, this can go on for years. Like I said earlier, with early struggles that we see like colicky, latching, gassiness, torticollis, all these things that morph into recurring ear infections, respiratory infections, RSV, and all these different things that then morph into hyperactivity, behavior, and mood struggles, and lots of different ADHD focus challenges for these kids. So when we see chronic stress from an early age in that birth process, that is why we see it change into different things later on, because that issue was never addressed at that root area. So if this sounds like your child, if this resonates with you as a parent, and your child had a very stressful birth, an entrance into this world, and they had similar situations and symptoms when they were little that turned into different things later on, and that you've been trying to figure out what the root issue is with your child, it doesn't hurt to get them checked out, to see a scan neurologically what is happening at that area in the neck or in the rest of the body to see if this could be the cause of their dysfunction every day. So this is something we do every day. We see kids for every single day. Ideally, the earlier the better, because then we can address those issues before they turn into bigger issues. But if this sounds like you or your child or someone you know, just give us a call. We can connect you with a locally found pediatric neurological nervous system based chiropractor near you. And if not, we are in your area as well, then that's perfect. And you can just ask us whatever questions you might have about all the things that I just talked about, and we can connect those dots for you and see if that might be something your child is struggling with. Thank you so much, and happy holidays.